Welcome to everyone who's joining. We're going to give folks another minute to join the webinar. Okay, let's get started. Hello, my name is Meredith Hendricks. I'm the Executive Director for the Center for Creative Land Recycling. I'm a pretty new Executive Director here at CCLR, been here 2 months. And so I'm eager to join all of you today in the discussion that our Program Director, Ignacio Dairet, will lead us through. So welcome to a brown bag brunch. I'm not sure where you are, but where I am, it's still morning. I'm based in Berkeley, California. And we have folks from across the country and internationally joining us today. Can we go back to the title slide, please? Somebody's getting excited. Thank you. So today is and I know who it is. It's Ignacio. He's ready to go. So today is the first in a series of what we're calling brown bag brunch webinars. And we're going to be talking about resilience in the age of COVID-19. It's a generalist guide. We all are looking for resources to help us navigate this unprecedented experience we're sharing in. And our thinking at Center for Creative Land Recycling behind this Brown Bag Brunch series was that we would put together some informal conversations that are based on topics we're all interested in discussing. And so throughout the webinar today, Ignacio will prompt attendees through some poll questions and try to get a chance to understand better what's on all of your mind. And you can certainly send questions through the chat function. Again, my name is Meredith Hendricks, and I'm the Executive Director here at the Center for Creative Land Recycling. I want to thank all of you for joining us today. And I want to thank the staff, the board, and the advisory board of the Center for Creative Land Recycling for welcoming me a couple of months ago to this role. And I want to thank all of you who support our work and get involved and join us in these kinds of programs. Okay, now Ignacio, would you please go to the next slide? There we go. So the Center for Creative Land Recycling, you'll hear it referred to as CCLR. I think many of you know us. We are a very small nonprofit organization dependent on support from people like you so that we can produce online education and webinars. We conduct policy and research related to land reuse, brownfield cleanup and remediation. We provide consulting and one-on-one or small group technical assistance. We're very connected with the EPA brownfields program and provide grant review to those of you who are seeking support and resources through the EPA. And you can find us online at cclr.org, cclr.org. My contact information is there on the screen. I'm Meredith. Ignacio Dairet is our program director and our wonderful host for today's webinar. His information is there. And Jean Hammerman, who is our deputy director based in New York, is also there as a contact. And you don't have to write any of this down. This presentation is available in the handout section of your webinar. And if you, for some reason, can't access it there, you can reach out to one of us and we will send it to you. Okay, moving right along. Bit of housekeeping. Well, first of all, I really want to thank the American Planning Association New York Upstate chapter for helping make this a certified webinar. And so this is an accredited APA webinar, and AICP certified planners who complete this webinar can receive some credit as outlined there. I already mentioned you can download a PDF of the presentation in the handout section. And we're recording today's webinar, and we'll make that available. And we'd sure love your feedback. In addition to letting us know what you thought of today's webinar, if you have some great ideas about content you'd like to see, please let us know. And we do this because of the community that we have around us, and we want to know what you need and how we can help, so please be in touch. Next slide. I already said thank you, but I want to say it again to APA in New York, because making this accredited really helps us ensure that we're delivering meaningful educational content to folks like you. Okay, next. And since we're all sitting at home, you have lots of time to tweet and do all of that stuff. So you can find us on Facebook, on LinkedIn, or on Twitter in the following social media ways. And at this time, I'd like to turn over the reins to Ignacio, our program director, who has been working in land redevelopment and land recycling for over 20 years. He's been with CClear for a very long time. He's beloved and well known to all of you. He is the guy that can help you figure out how to write a smashing grant application and secure resources for your projects. He also is a teacher, and I think that will come through in today's presentation. And he has an emphasis on resiliency, sustainability, and livability, which is why he's leading us through this conversation. So, Ignacio, delight and surprise us. You're welcome.
Thank you and good morning. It's a pleasure to be here with you given our circumstance. I wish we could do this in person. Before we start, we have a few polling questions. So Yelena, please take it away. Oh, okay. Have you heard of the CARES Act? All right. Oh, okay. I was expecting more people to have heard of the CARES Act. We do have quite a few people calling internationally, so that could be the reason. The next question is, not that one. Have you ever applied for a brownfields grant from the EPA? Okay, quite a few of you have not. And we hope to change that, but that's not the reason for this call, or maybe it is. But let's go on to the next. I think we have another polling question. What type of entity do you represent? And I think we only had 5 choices in the software. So if you do not fit into any the others, we're sorry we couldn't fit you in. All right, so lots of state, local, and tribal governments, some federal folks, nonprofits, and consultants. Thank you very much. Let's go on. All right. Okay, Elena, I'm waiting for control. Okay, I think I have control. Oh. All right, so in this webinar, I'll give you a brief update. And I know you're getting news every hour or even more often of the status of what's happening with COVID-19, the government's action and the prognosis we're hearing. And then we'll switch over to resilience. We've heard a lot about our health system and the health resilience. Public health is one of those resilience topics we hear a lot about, but there are other topics which cover resilience. And I am going to try to show you if there is a connection between land use, brownfields, infill with these other resilience topics. And as planners in economic development and other staff, mainly for government, what you can do now. So every day we hear heartening stories of how people are innovating to COVID-19, the circumstances we have. Of course, people are buying as much toilet paper from where they can get it. So don't eat too many donuts when you buy toilet paper, or don't buy too many donuts so you can get a toilet paper. But I've seen that picture around, floating around. Now, for those who have not heard the CARES Act, that is the bill that was signed a few weeks ago into legislation, which is a response. It's called the third stimulus response to the COVID-19. The first 2 were smaller labor bills, and the CARES Act is a $2.2 trillion economic stimulus a rescue package for the
Hi,
COVID-19.
Ignacio. I'm sorry to interrupt. I'm seeing that some people are having audio issues. Um, I just wanted to see if everyone is having the same problem. If you can contribute, if you hear anything, okay. Haiti, looks like you hear. Ignacio, can you say something just to make sure that everyone's audio works? Okay,
Testing,
there's some
testing,
people. Okay.
testing.
All right. It looks like there's some people that can't hear. I would suggest you check out what's going on with your audio devices. There is a overwhelming amount of people who actually can hear. So I'm going to just give this back to Ignacio. Sorry, pardon the interruption. Please do keep on providing your comments if you're experiencing any issues in the question box.
All right. Okay, so I will continue. And again, please put in the chat box if you're experiencing audio problems. So, so there has been the stimulus package. Okay, I lost. How were we starting? Okay, should I continue? All right, I'll continue. So the stimulus package, the CARES Act, really addressed some of the employment and income and unemployment that's occurring right now. And already we've seen from the rollout, there have been some issues. There are some capacity issues at the federal government in rolling it out between the banks and the federal government. And we've also seen that social distancing is actually causing some economic isolation for some people. Today in the news, actually maybe 2 days ago, there has been some news about certain communities that are which are usually the same community. Okay, audio. Okay, what phone number should I call?
You're on. I can hear you.
Okay, all right. Sorry about that, folks. I guess you can hear me. All right. So moving right along, I'm sorry for the delay. Uh, so we're worried about the social distancing that is happening. I mean, this economic isolation that is happening with the social isolation. And so next slide, please. Yelena, can you move the slide? Because I can't seem to move it. Well, I will proceed. I'll go on with while we're working on the visual. Uh, so right now, the rescue package was released 3 weeks ago, and that's probably going to make its way through for another couple of months. The money, as we know, is already oversubscribed. Here we are. What we're calling the rescue package will be probably occur between April and July. And there's already talk about another recovery bill. It's being discussed in the Senate and Congress, Senate and the House. So that will probably happen, roll out the end of the month, and probably be rolled out slowly over the next 3 to 5 months. So we're looking at about July to October, we're in recovery mode. And what happens to that is a rebuild. Right now, we're worried about people's jobs, their incomes, keeping afloat. And as we recover, we will see how the economy shapes up, how many people get their jobs back, uh, how many employers are able to go back and go back to their businesses. But there will be a rebuild, and so we will have lots of cities with strained economies, and and we'll also see changes to the the legislative branch and the executive branch because we got elections coming up. So next slide, please. And the impacts again have been health, economic, housing, infrastructure, equity, and the environment. Uh, Again, there have been direct and indirect impacts of these. Of course, economic, we've lost jobs, and then and for housing, we've seen the relief provided to renters and to mortgage holders. And then the infrastructure. We have lots of infrastructure right now that's really underutilized. We have freeways that are vacant. We got uh, transit that is really running a third of capacity. And again, equity, we're seeing now, based on the data that's been trickling in the last week or so, that there are many communities of color and lower income communities and the homeless that are being disproportionately impacted by both health impacts and the economic impacts. And for the environment, it's been mixed. Of course, our air is cleaner, uh, but at the same time, we're not recycling as much. So it's rather mixed, and the data is not completely in yet. Next slide. Now, so that's COVID. That's kind of what's happening, and I don't want to dwell on it because it's really, you can follow the news yourselves, and your local situations are very different. Uh, but there are many themes in healthcare resilience. There have been past pandemics. We had Ebola, there was SARS, there was MERS, and uh, ov- over these efforts, there's always been the reaction by the public health community is always to figure out how can we be resilient? How can our health systems recover for this or prepare for it? And they have had very many discussions following these events uh, involving local government, international, state, federal, WHO, and and the my there have been findings both by institutions like Johns Hopkins, the CDC, and WHO that while there are many themes, they can't really agree on a process or implementation framework. And for number 4 and 5 there, these are kind of my interpretations. Is that we have many, even in the health community, there are silos that prevent them from really moving forward. Uh, and we find this also in other disciplines that seek to be resilient. Next slide, please. So, what are these other efforts? Well, again, for health, there are pandemics and public health itself, delivering good health to lower income communities. And then resilience efforts for climate change, which involve livability and sustainability. And this is where we find most brownfields efforts to be covered. Then there are disasters, earthquakes, flood, and wildfires. And then food security, food resilience is also a very common discipline. And of course, safety. and terrorism. And it's very rare when we find discussions on all of these, I guess with the exception of livability and sustainability, that we find that there's cross-fertilization. Next slide. So what are common resilience goals? I looked over very many of these efforts to establish resilience. And while they can't agree on how resilience works for their various disciplines, there are some common definitions and goals. People have to adapt, or our communities have to adapt, which means altering our behavior systems and in some cases ways of life. And we have to mitigate, which is basically avoiding and reducing impacts to prevent further damage. And this requires communication, partnerships, and some kind of safety net for those that have the most difficulty adapting or mitigating the impacts. Next slide. And now this visual is borrowed from one of many efforts that involve adaptation mitigation. But the measures do have adapting and mitigating. There is a overlap in efforts, which are specific efforts. This pertains mostly to livability and sustainability. But in order to adapt and mitigate, you need some physical development, construction or some kind of, brick and mortar improvements. And you need governance partnerships and good communication, and you need money, both in straight out grants or financing. Next slide. Now, so how do we construct? What is the, how do we go through a thought process of how to adapt and mitigate? And, again, looking over the literature, I found that the Urban Land Institute had 10 principles for sustainable communities. Of course, theirs are built communities, but winnowing it down to something more manageable, I find that there are probably 5 principles that to abide by to simplify the thought process. First, you have to accept that you have vulnerabilities. For instance, if you don't think climate change is a vulnerability, then you'll never get to the measures. If you don't accept that you have a public health vulnerability, then you'll never work on those measures. So you have to accept that you are vulnerable. Then you have to understand the impacts of any inaction. Then you adapt with any technology tools and the limitations of these tools. So which means as technology changes, you adapt again, you keep changing. So things never remain the same. Then you have to apply equity because there are those who will not be able to adapt given their limited capacities and resources. And then you monitor and feedback the response. I'm going to show a couple of charts that kind of illustrate this. These are no, these are not taken from anything. It's just more of a thought process just to illustrate how this can work. Next slide. So going back to those principles, accepting vulnerabilities, understanding your inaction, adapt with technology, apply equity, and monitor your feedback response. As an example, public health. In the United States, there is no national public health system. We have Medicare, and we have public health insurance, and a lot of nonprofits that provide basic services to vulnerable populations. So a possible impact of that inaction is, again, vulnerable populations are left unserved. So you adapt. Local and neighborhood clinics provided by NGOs provide preventive services, but then and then they receive public and foundation support so that they can, they can have facilities, they can deliver services. And possible feedback of that is, when they have a serious illness, if they have cancer, if they have another serious illness, there's very difficult for them to find services. So that's kind of a construct for public health, and there could be many impacts for inaction, uh, and uh, and there are many ways you can adapt. Another would be a disaster. I use firestorms here as an example. Uh, in California, there have been wildfires the last 3 years, and they've been really been most uh, prevalent in the urban wildland interface. So, and many of these communities are in rural areas. Some are in suburban areas, and you, you try to adapt. One of the proposed adaptations is more compact rural development, so less, less sprawl even in rural areas. Uh, Another probable, a possible adaptation, which I don't have listed there, is maybe solar panels or locally generated uh, energy, so that you don't have power lines going in and out many distances. And then applying equity, again, financing and grant programs to rural areas because they really don't have the economic capacity to support the kind of development they need to protect themselves. But then there are property rights issues that come into play. There are ranches, there are grazing lands, and then you also have uh, public lands. So this is a possible feedback or response, an issue that has to be addressed again, which is again a vulnerability of that solution. So it's kind of a feedback, and you go back and try to solve that issue. Next slide. Here's another, brownfields and climate change. Uh, and here identify the same problem, the vulnerability, sprawl. For brownfields, uh, the blighting conditions in core cities and town centers is, what happens if we keep on sprawling. You adapt, you try to recreate downtown. But many downtowns can't support the redevelopment or the cleanup. So that's where financing and grant programs from the EPA and the states are helpful. A possible feedback of that is NIMBY, not in my backyard. There are neighbors, even in central cities, that do not want the kind of development that comes with more density. For climate change, sprawl is also an issue, congestion in freeways. Uh, so you can adapt, you can retrofit suburbs for density and mixed use so that they can create their own downtowns and travel less. One adaptation we've seen very often with sprawl is that build more freeways. I will bring up later a study by Smart Growth America that basically says this is not an appropriate response because it actually leads to more congestion. But basically, going back to the thread of thought here, again, we need financing and grant programs for low and moderate income households in many of the suburbs or ex-burbs because communities, many of the residents can't afford to live given construction costs. Next slide. So where do brownfields come in here? Well, in the 20 plus years I've been working through brownfields and working with communities around the country, the EPA and the program and even the states do intersect with a lot of these efforts that can build up community resilience. People have heard about the health fields. That's where public health and food resilience come in. Climate change and disasters. The EPA program works on green infrastructure, smart growth, bright fields, and other efforts. And we find, and we've always found at CCLEAR, that brownfields has a role in building resiliency to rescue, recovery, and rebuilding efforts. Next slide. So here are the agencies with compatible programs. And we saw this about 12 years ago when after the Great Recession, the EPA, of course, they had partnerships with the Department of Commerce, Economic Development Administration, which, by the way, has a big chunk of the CARES Act. Housing and Urban Development, HUD, also has a big a chunk of of the CARES Act. And Agriculture and Rural Development also has a big chunk of the CARES Act. Then there's Transportation, Energy, and other agencies. Next slide. So when are these opportunities coming? And again, I repeat, you can build resiliency into recovery and rebuild efforts. So the ones that are coming up, we have the CARES Act, which is the rescue bill, covers some, the USDA, EDA, the Small Business Administration, and HUD have some funds to cover the first wave of impacts from the COVID-19. But as I mentioned earlier, Congress doesn't is thinking that it's not enough, and there has to be a fourth bill. And as they're even discussing the terms of the fourth bill, there might even be more activity after that. Uh, the fourth stimulus bill, based on discussions from the last few days, will cover healthcare, small business, state and local government assistance, mostly smaller communities, because the third stimulus bill really did not provide enough assistance to smaller communities. But there's a lot of disagreement in other areas, and that's probably where additional actions will happen 6 months out from now or later. Next slide. So for next steps, again, resiliency efforts are cross-cutting. We think brownfields is a good way to start for those communities that have not. Please look at it, because you'll find it just the brownfields efforts do just cover not just site assessments and cleanup. It covers many other studies and efforts like community participation, outreach, economic analysis, community planning, and other efforts. So it's a good place to start. And approaching resiliency really is a good story to start with, not just with the EPA but other granting agencies. If you are crossing silos, then you're thinking more holistically and will tell a better story. But you have to collect your data information now. Now everyone's at home, or most people are at home, but there are many data sources there that you can find and collect so that you can start building your story. And that's a separate webinar. If you want for us to organize one, we can certainly do that, but there's too much for that to cover in this webinar. And also strengthening partnerships. It's kind of hard to shake hands with someone who's on the other side of a screen or of a telephone. And so there will be new techniques and methods to reach out to partners. And those partners will have to figure out how to reach out to the communities and stakeholders who actually do not have internet access. Or if they have internet access, maybe their broadband is, they don't have broadband and can't participate in webinars because their connections die every 5 seconds. But these all weave a story. And so as we always say in the EPA, you have to have a good story. It's the same thing with every other federal agency. And now the CARES Act hasn't been fully rolled out yet because they're still figuring out a way of distributing the money. Some of you will receive your $600 to $1,200 checks. Use it wisely, but But again, those are still being worked out. If a fourth response bill comes out, probably by late April, visit the department web pages, and you will find that many of the grant programs that are available there will not serve your needs, the needs that we have now, because it's unprecedented. Now, there is a Federal Reserve survey. I received one just this morning. And if you happen to receive it, respond to it, because that's the only way to get word out to the federal agencies of what your local conditions are. Also, a Smart Growth America has proposals uh, for a forced stimulus plan. It came out literally like 2 days after the CARES Act was released. So there are already many efforts at filling in what the CARES Act does not cover. Next slide. Good resources. Well, I always look to the news. Of course, don't look at the news 24/7, because you're not going to be able to sleep. I'd like to check both all kinds of newspapers, both left-leaning and right-leaning. It's always good to know what everyone is talking about. The American Planning Association COVID Clearinghouse has a very good list of web resources. One of the resources is ICMA. So I don't list it here, but ICMA is the International City County Management Association. But the APA website has a very good list that you can go through. Visit your state federal department websites for housing, economic development, small business, your councils of governments and your metropolitan planning organizations are continually updating their websites in response for both handling rescue, recovery, and rebuilding. The Council of Development Financing Agencies, I list them because they have a pulse for small business and public financing and what kind of projects they see coming down the pike. And of course, again, some Smart Growth America. And for advocacy, clue into what your affordable housing, small business, and environmental justice folks are saying, because they, they feel the impact, or at least the lack of services first when they go through these bills and they identify where the weaknesses are. Because again, these are the same communities that the brownfields communities stakeholders serve, and there are a lot of shared concerns. Next slide. Again, CClear can help. As I've outlined here, we can help you think out your issues. If you prepare your grants, we can help you prepare them now or when they come out. Last we heard a couple of weeks ago, the EPA brownfields will still plans to release the grants in the fall. And now is a good time to reach out to folks for partnerships and figure out how you can strengthen those, and again, how to reach out to the stakeholders that you all serve. Also for visioning, our neighborhoods will change a lot, and we might be able to change them for what you really wanted them to look like before this crisis happened, or you can vision it for what's happening right after the crisis. For webinars, in a couple of weeks, CClear, New Jersey New Jersey Institute of Technology, and Kansas State University will have a webinar to address the EPA MARC grants. MARC stands for Multipurpose Assessment Revolving Loan Fund and Cleanup Grants. So that's in a couple of weeks, and it's over 2 days. The next Brown Bag Brunch webinar would be with Alan Malach, who will be talking about you know, environmental justice and how cities, uh, cities can move, uh, can recreate themselves and how they can address past injustices. We have past CClear webinars on our website. We work on conferences and workshops with our state and regional partners and nationally with Kansas State and NJIT. We have online resources, and since you're binging on TV, go to the YouTube CCLR TV or CClear TV, and we have a lot of uh, videos there, short videos, so you're not sitting all day on your computer. Next slide. Question and comments. Thank you again for bearing with us with our technical difficulties. I think it's the internet traffic has hijacked our GoToMeeting. People probably have heard of the Zoom bombing. I don't think anyone bombed our GoToWebinar, but we appreciate you hanging out. Thank you. So do we have any questions?
You can add your questions into the question bank that's located in the right side of your screen on your console. We'll wait right now to have any questions roll in. But one question I have for you, Ignacio, is what is Smart Growth America suggesting for follow-up bills?
Yes, good question. Smart Growth America, again, they're going to have a webinar, I think next week. I think it's on tax day. Of course, tax day is July 15 now, but the original tax day, April 15, they were going to go through their list of efforts that they're more of the on the recovery and rebuild side of the equation, and they deal with housing, brownfields and infill, walkable communities, and transit. So it's a quite a comprehensive list. They again, of course, touch on smart growth and making communities walkable. And one thing that uh, you know, uh, I didn't put any soapbox type ideas into the slides, but I think one thing that would strengthen communities really, and I think it does show from some of the news we see, is that the communities that are walkable are those that are faring better than those that are not. When in the news that we find in many communities that are isolated, they're not necessarily sprawl. Many of them are inner cities, but these are communities that do not have the services, particularly the groceries or the parks, anywhere near them. So they actually have to drive out of their communities in order to obtain these services. So this is one key, uh, uh, I guess, action that everyone could look at is that look at your neighborhood's walkability. And I tend to default to the walk score. You can go to walkscore.com, and they score communities based on how walkable it is. Uh, the scores are uh, geographically based, and it's by neighborhood. It's not by city. So if you went to New York, you could have walk scores ranging from 100% all the way to 20%. So it's really when you're looking at your cities and your communities, the better the walk scores, I find there are more resilient and really more livable. So that's my soapbox speech for the day.
Great, thank you. So we have a couple of questions that just rolled in. One is from Joseph Hacker. He asks, how do areas with significant greenfield alter the lens with which you approach resilience?
Okay, so good question. So when you say greenfield, I'm assuming that you are either in an outer suburb or in a rural area. And rural communities have a very different approach to resiliency because, uh, for one, there's a reason why the government has the USDA and rural development. By default, rural communities need assistance because the economics, just the cost of infrastructure, is expensive for the internal economic capacity or even business capacity of a rural area or even a suburb to absorb. So if you're a suburb, let's say a bunch of subdivisions, I again walkability would be important, given that you have many probably subdivisions that are designed to exclude. The best thing you could do is make more trips accessible with one parking by parking once. So they can park once at a mall, or they can park once in downtown, and they have the grocery store, the drugstore, the hardware, city hall, or the health clinic there within walking distance, or maybe a short bike ride. Uh, for true rural communities, and we like to call them frontier rural, there's always Main Street. And all main streets all over the country are impacted or stressed by big boxes, big box facilities outside town. So they tend to be outside the incorporated area, and they're in the county area. And this is where the general economics of our country is. Um, you know, we're built that way, so we have to deal with it. Unless we change our economic structure, you have to deal with the big box go outside town to compete with your downtown. Again, the principle is the same. Just try to park once in downtown, make it unique. Have as many facilities nearby that you can do with walk and encourage interaction. Make them safe and preserve. I would stress to preserve what you call the green fields, especially uh, if they are not sandwiched by development. If it's a green field surrounded by other development, maybe it's a good strategy to create add on to your downtown by making producing a dense walkable neighborhood. But if you're a green field in the outskirts of town, I strive to preserve that as agricultural or open space. And again, there are tools to make that possible. Uh, One again, going back to the chart I created, there are property rights involved in that, uh, where the property owner might say, well, the subdivision is happening a mile from here. Why can't I put a subdivision in my place? Uh, there are economic solutions to that. They won't equate to what they might make if their site were became a subdivision, but that's again, there are tools for that, like conservation easements, transfer development rights. And that's why we have the APA here, is that they can talk to you about transfer development rights and conservation easements and other tools.
All right, thank you. We have 3 more questions. This one is coming from Waldman. Healthcare policy is largely out of the realm of the city planning profession, aside from building healthy communities. What are ways planners can advocate for municipal hospitals or other ways to strengthen local health systems to respond to the current and prepare for the future pandemics?
Okay, right. Good question. And I struggled with this because, again, healthcare is not my expertise, but many communities, I create what they call our, well, they try to keep their stakeholders healthy with access to good food and walkable neighborhoods. They find that physical activity uh, and healthy food prevents a lot of health issues. It prevents diabetes, high blood pressure, and having a solid, healthy population is probably the best thing one can do. And uh, supporting the development of those in the neighborhoods that need them is probably a good start. Uh, and then you can the next steps would be really be more political and policy questions, which have to come from your city council, your regional government, and your state, because that's all national policy. We've all heard about in this past, ongoing elections. We've heard all about healthcare and the different solutions. We hear about what other countries are doing. Uh, there are pros and cons everywhere. We have a system, so I think going back to the needs of the poorest will serve the purpose of the safety net that will decrease the strain on the rest of the health industry.
All right, that was a great question. This question is coming from Bimbola. When we talk about cut crossing, how is America involved in terms of AIDS provision to the less developed countries combating COVID-19?
Okay, that's way out of my wheelhouse. I'm assuming this is one of our international folks. Uh, I would have to defer to the CDC and their um, their partners and their connections with the WHO. Right now, the United States is in crisis mode. Uh, some states are doing better than others. So what I would suggest is look at what California is doing. California has had a good response. It hasn't been as bad here as in other places. Uh, and learn the lessons from California and the other countries like Singapore, Hong Kong, the denser communities, and see what tools they're applying. A lot of it will be aid through equipment uh, and uh, and tips on behavior changes to limit the spread of the virus.
All right, we have two more questions. This one is coming from Waldman. How do we promote density and refute myths that density is dangerous in light of COVID-19? And how can we build more resilient ways people can live and adapt within dense cities?
Okay, well, as far as COVID-19 and density, you can look at what's happened in Singapore and Seoul and Tokyo. Of course, the numbers aren't in yet. This is still an ongoing epidemic, so we don't really know where it's going. But and we know that New York, Manhattan is very dense, but parts of San Francisco is pretty dense too, and the inner East Bay in California. And the numbers here are not quite as bad as you would have imagined, and they're certainly much lower in communities like Hong Kong and Singapore. So these are behavior uh, responses that they've been able to adapt in order to keep safe. So density is not bad, and we certainly do not want, many communities don't want skyscrapers all over, but there are many communities that are mid-rise and a few high-rises that are very pleasant and still safe. And I think I have to wrap up soon. The second part of that question, can you repeat it, Yelena?
Yes, of course. And how can we build more resilient ways people can live and adapt within dense cities?
Well, there are many lessons. CCLIR will actually have a webinar on walkable communities and a streetscape in a couple of months. So I think stay tuned for that, because I can go on forever on those types of approaches. So please look out for the next one of the next few webinars that CCLIR will have.
And our final question, coming from Michael Callahan, are there land use goals identified in the CARES Act that can have been included to address specific problems related to the epidemic or pandemic impacts and trying to achieve resilience aside from land use classifications?
I do not think so. CARES was mostly a rescue package to keep small business and communities afloat for the next month or two. Those type of initiatives I would put in the rebuild aspect. And again, that's where advocacy, as far as what Smart Growth America will be advocating, and you might find in some of the ideas in the fourth stimulus bill, but I don't think that goes actually as far as what you are suggesting. So I'd leave it at that, but I recommend that you watch the Smart Growth America. You tune in next week. Thank you so much for that question. And thanks so much for joining us today. I'm sorry for the technical difficulties. A lot of you stayed with us. We're very appreciative. There's a survey coming after this, and Yelena, I'll hand it off to you before, but I'll say my thank yous and goodbyes now.
Thank you for joining our first of our brown bag brunch series. I hope you tune in on April 21st for the next one. You can register via our website, cclir.org/webinar.